In this video, we'll be discussing Standard 4 from the Child Wellbeing domain, or CW4. CW4 states, program delivers an array of program practices that promote the physical health of children and families. What's the intent? To ensure the program utilizes a comprehensive approach for children and families to receive the necessary support to maintain and improve their physical health. By incorporating nutrition and physical activity into classroom instruction, extending outdoor play, and aligning menus with the standards of the Child and Adult Care Food Program, programs can foster a healthy and nurturing environment. Additionally, daily health checks and program-sponsored health fairs for families further contribute to the overall physical health of the community. How many points are possible? You may receive up to 3 points. For one physical health activity implemented, you may receive 1 point. For 2 activities, 2 points. Or for 3 or more physical health activities implemented, 3 points. What is the recommended evidence? There are many ways to meet this standard. Evidence for this may include documentation reflecting nutrition and/or physical activity curriculum, lesson plans that reflect nutrition and physical activity content that's included in classroom instruction, program-sponsored health fair for families, or daily health checks implemented, extended outdoor play reflected in schedule and practice when the majority of children are present. To know whether you're providing extended outdoor play, please note that this is in addition to the minimum recommended time in the ERS, which is at least 1 hour per day. At least 30 minutes need to occur during the ERS observation. Extended outdoor play would be above and beyond this and could include activities such as outdoor classrooms, sports, socialization games, and free play. Program menus align with the standards of the Child and Adult Care Food Program. Should you choose this route, if your program has menus, then your menu would need to demonstrate how you provide all components required by CA-CFP. Your program would need to supplement for children who pack. Programs who do not provide food would need to supplement for any missing meal components to meet this standard, if this is the evidence you seek to provide. Here are some tips. When planning how to meet this standard, consider the most effective way to engage your enrolled families and how they prefer to receive information. Tailor your efforts to their specific needs. For example, a breastfeeding workshop led by a lactation consultant may be valuable if your families include nursing mothers. In such cases, be sure to document outreach and attendance. However, if your program primarily serves preschool-age children and families are not currently breastfeeding, alternative strategies such as embedding healthy nutrition and physical activity practices into daily routines may be more appropriate and impactful. Sending out surveys to families to find out what best meets their needs can help you identify what types of support to provide. If you decide to provide nutrition and physical activity content in classroom practices, consider lessons on nutrition and discussions on healthful eating, limiting screen time, a study on exercise, or dance time offered outside of gross motor time. One way to embed physical activity in your classroom is to offer a shake it out corner, or a place where children are encouraged to move, follow yoga pictures on the wall, or practice balance and coordination. Ensure children get outside to play every day, weather permitting. If the weather prevents outdoor play, use open spaces for gross motor movement. Now, your QIP. The way you choose to meet this standard will influence the types of resources and supports required. For example, health and safety workshops should be led by qualified professionals. Consider which community partners you can engage, how you will inform the families of the event, and how you will document participation. If you plan to increase outdoor gross motor play, determine how schedules will be adjusted and which activities may need to shift. For initiatives such as daily health checks, outline the procedures and how they will be consistently implemented and monitored. A sample template is available in the mandated reporter training required by CCDBG. When finalizing your QIP, assign responsibilities for each component, especially if you have an implementation team, and ensure someone is designated to oversee progress and collect supporting documentation. Your QIP must include projected completion dates, and you should consider how your documentation of physical health and nutrition practices aligns with your rating submission timeline. For further guidance on the standard and your specific program's needs, please speak to your technical assistance specialist.